Hey, I'm Dr. Brady Wyrick from Sensor Medica Clinics, and what I want to cover with you today is Shockwave therapy, our Shockwave therapy device. We're going to specifically use it for a plantar fasciitis case with one of our patients. So I'm going to walk through with you what is in the case when you get the device. We'll walk a little bit through setup and settings, and then we'll show you specifically how we use it for, in this particular case, plantar fasciitis. So hang on, here we go. Okay, so when you open the case, what you're going to find is the unit itself. You're going to find the applicator head here, the stand here. Underneath the stand, you'll find the pedal. Excuse me. Underneath this case, you're going to find the pedal, which is the actual trigger for the device. And then you have a couple different applicator heads here, depending on how small the area is that you're going to treat. And then several covers for the applicator, because these do wear out with several cleanings. And of course, power cords, everything's included in the box. Setup is very, very easy. It's well labeled. We have power source here. So the power source goes in here, applicator head goes in here, and then of course the foot pedal and the trigger. Once your device is plugged in and ready to go, then you simply hit start. You're going to go here to therapy, and you're going to select the body part. In this case, we're going to be doing the foot. And we're going to be doing plantar fasciitis. It actually gives you a little list here. So we're going to select plantar fasciitis. You choose between acute and chronic. Notice the indication is here, and then the treatment recommendations are here. I'm going to click on chronic. That's going to change slightly, and then we're going to go to treat. And the machine's already set up for 90 millijoules at 10 hertz. If the patient can't tolerate that, you can turn down the millijoules. As the patient becomes more used to that, you can actually turn up the millijoules. I'd leave the hertz, the frequency alone. The higher the frequency, then the more superficial the treatment will actually be. So this is the preferred setting that we use for plantar fasciitis, and then it's already pre-selected at 3,000 pulses. I may change that depending clinically on what I see with the patient. All right, so now I've got the machine set up for chronic plantar fasciitis, which Stacy's been dealing with here. And now what I'm going to do is take a little bit of warm ultrasound gel, and I always have to remind myself when we're doing peripheral neuropathy that I cover more of the sole of the foot, but when we're doing plantar fasciitis, then I'll cover the insertion and the origin of the plantar fascia. That's basically where I'll stop and start from and go back and forth. So a little warm ultrasound, an ultrasound gel warmer goes a long ways for patient comfort. And then we'll just take the applicator head. And I always just take and spread the ultrasound gel out just a little bit over the area that I'm going to treat. And then I'm going to use the foot trigger to activate the Shockwave. And I'm just going to go back and forth on that plantar fascia. And the way I will word this to the patient when I'm doing this is exactly this. Shockwave therapy, PulseWave therapy, whatever you want to call it, creates an acoustic wave that creates microtrauma in the tissue that you're treating. I hate using the word microtrauma, but I can't think of a better one. And basically what that does is stimulates the body to release chemicals called cytokines and growth factors to aid and to heal and to speed the healing process, or as my nephew calls it, tricking the body into healing itself. Now, the advantage with the Shockwave therapy, and that's what I say to the patients. Then we're back here to the video. The advantage here is as you get good at this, you'll learn the parameters of the machine, and then you don't just have to use the presets. You can customize it for any of the people that you're treating. So that is Shockwave therapy in a nutshell, using our FreeWave device, and that's how we apply it here in our clinic.